Welcome to True Health Tuesday, and the truth will set you free. Today is an exciting one. Now, this is number one, what can you do when you feel hopeless? And we're going to go over a couple of questions that I get a lot. Number one, from Tracy, 21 Able. I can't get help. My organs are struggling. Pancreas insufficiency, fatty liver, rapid heart rate, but I can't get help. I need some advice. I suffer in silence. I don't trust doctors. I wish we had you here in Australia. So when we look at this, pancreas insufficiency. Now, when you know that gallbladder drains through the same opening as the pancreas, and under physical, chemical, emotional stress, the bile that comes out of the gallbladder, it turns into bile sludge. This is what eventually forms into gallstones. Now, this is going to cause that pancreas to not function correctly. Rapid heart rate, that means the blood is not efficient at holding its oxygen or doing its job. And so the cells, the red blood cells, instead of having that beautiful electronegative charge, they start to overlap. So the heart rate's going to increase in order to adapt to the stress. So these are all stress responses. When we look at feeling hopeless, from Jan Post 9435. I've been going to chiropractors for 40 years. My spine is a mess. So many car accidents, scoliosis, twisted, disc damage, lots of stress from effects of Lyme disease, poor sleep, and until recently now freaking out with wet macular degeneration, suspected caused by medication, feeling hopeless. Your suspicion or suspects of having medication, non-steroidal anti-inflammatories, high blood pressure medications, even certain drops can cause wet macular degeneration. The Lyme disease, it's not from a tick. Okay, this has to do with a weakened immune system. So let's say 10 people get bit by a tick. Not all 10 are going to get Lyme disease. And poor sleep patterns, sleep is when the body regenerates. So again, this is caused from the stressors that you're under. Now, the number one question I get, and this is almost every single video I get uploaded to social media, at least one person says, where do I find a chiropractor or doctor like you? Now, the goal of all of my videos is so that you can learn how the body works. Now, understanding anatomy and physiology is the key to learning how to work with your body. The 5 keys to health will guide you through the process of radically improving your overall health. A chiropractor or healthcare professional should only be needed for a small percentage of the time when it's not possible or very difficult to learn how your body and to implement solutions. So learning how your body is adapting to stress and how to correct the underlying factors. Now, just from these videos, you're going to know a lot more about the human body than most people. You may not be a doctor, but you have enough information to get the healing process started. You should be able to answer the following question. How do you begin the healing process? That's it. You've got to look at the quality of your questions is going to denote the quality of your health. Now, if you look at all health problems have one cause and one solution, the one cause is stress. And the one solution is to address the underlying cause of that stress. And then the body can regenerate. You allow the body to heal. There's only 3 stressors: physical stress, chemical stress, and emotional stress. And we're going to show you how to address all 3 of those. What's the first step? Number 1 is the quality of your questions. Now, allopathic questions, and this is more of when you go to the standard doctor. How can I feel better, doc? What do I got? How do I treat it? What drug or therapy do I take? Now, these are they're the wrong questions to ask. The wellness questions, what I pose to my patients and what I ask them to ask themselves is, what am I toxic with? What am I deficient in? And why do I have these symptoms? Now, when we look at the 5 keys of health, proper nerve supply, regular exercise, proper nutrition, sufficient rest, and prayer and meditation, let's detail out what those 5 keys to health are and what you can do right now to address it. Number 1, proper nerve supply. Now, when we're looking at, this is the side view of a normal neck on the right, and then we're looking at a reversal of the curve, which means This person had a whiplash trauma. Now, this is going to cause an interruption in that communication from the brain or central nervous system to the body. And this is what happens to the physical trauma there, but the inability to adapt to trauma, toxins, and thoughts. So what happens is, first, kinesiopathophysiology. That means there was a physical trauma. This leads to the neuropathophysiology, which is going to be the nervous system is going to respond to this in a stress fashion. This results in muscle adaptation. So tight muscles, weak muscles, atrophy, or myopathology. Then this actually changes the cells or the histopathologic response, and then it eventually results into pathology. And this is what people are diagnosing with, which this is the end result of adapting to that stress. Now, when we talk about subluxations, a subluxation is a vertebrae that's misaligned with the vertebrae above and below, causing an interruption of that nervous system or causing a stress response, limiting the body's ability to adapt, repair, and heal. Now, cervical exercise, simple thing that you could do right now. Get a towel. This is a TheraCurve used on the left. And you just pull down with about 2 pounds of pressure and look up to the ceiling, then look straight ahead and relax it. Or you could lay on your tummy and put your chin in your palms and deep breathe. This will help to restore that curve in the neck, which is also called the arc of life, or the posture pump. Fantastic. We give the posture pump to almost every patient. So that's going to restore the nerve supply. And again, this is just a rough overview. Regular exercise. What does that mean? Now, lack of movement or sedentary lifestyle is a physical stressor, but also there's high disease rates at the extreme athletic. So the balance is what we need for a human being. But what does a sedentary lifestyle do? Number one, it increases all types of cancer, cardiovascular disease, depression and mood disorders, memory loss, cognitive decline, dementia, Alzheimer's. Remember, that brain is like a battery and it gets its charge from the correct position and motion of the vertebrae. Type 2 diabetes. This is, again, a stress response, erectile dysfunction, loss of sex drive, and literally deterioration of your spinal health. So what does regular exercise do? Number one, you get high quality sleep, and sleep is when the body regenerates. You can maintain a healthy weight, either gain weight or lose weight. It improves your resistance to infection, it improves your brain function. This means neurogenesis. It regenerates the nervous system, angiogenesis, and blood vessel formation. It prevents and relieves chronic pain. It can improve your emotional health. It lowers your risk of cancer, heart disease, diabetes. You got to move every joint every day. Simplest exercise is walking. Okay, walking is the simplest thing. Now, if you're able to walk on grass or hard sand, you're going to start to work the intrinsic muscles of the feet as well. Now, for high-intensity interval training, this is, again, fantastic. You warm up for 3 minutes. Exercise as hard and fast as you can for 30 seconds. By the end of this 30 seconds, whether you're weightlifting or running aerobically, by the end of the 30-second period, you should be in oxygen depth and have difficulty in breathing. You're going to begin to sweat profusely around the second or third repetition. And you're going to feel a muscle burn as your lactic acid increases. And then you recover for 90 seconds. Then repeat the exercise and recovery 7 more times. So this is high stress for short periods of time. And breathing, fantastic. If you have trouble walking, if you're bound in a chair, if you're wheelchair bound, breathing exercises is one of the greatest things in the world. For one, you sit up straight, put your tip of your tongue against the back of your front teeth. Keep it there through the entire breathing cycle. Then you breathe in silently through your nose to a count of 4. 1, 2, 3, 4. Hold your breath for a count of 7, and then breathe out twice as long as you breathed in, or 1, 2, 3, 4, 5, 6, 7, 8. Then you repeat the cycle 3 to 4 times, and this is going to be so you do this 7 cycles and diaphragmatic breathe. So that diaphragm comes down, that tummy should be going out and in like a bellows. Proper nutrition. Number one, water intake. And I'm talking 50% of your body weight in ounces in water. So a 200-pound person needs at least 100 ounces of water minimum daily. This is the best blood thinner in the world, plus 70% of your body is water. Then optimal diet. It's just like your ancestors. What did your ancestors do? Well, number one, they only ate organic. So organic plant-based diet. Plant-based doesn't mean only plants. It means the majority of calories are coming from plants. You can do a carnivore diet, but it's got to be healthy animals. Then healthy fats such as coconut oil, olive oil, and again, always organic, fermented vegetables, probiotics so you can build that gut flora, juiced vegetables, blended fruits, raw dairy, amazing for you, and reduce the omega-6s and increased animal-based omega-3s. It's the easiest ones to absorb. Then look at sufficient rest. This is one thing our parents never told us, that sleep is the most important part of your day. This is the regeneration cycle of your body. Now, what does lack of sleep have? Number one, it has a cumulative effect on your body. It weakens your immune system, aggravates chronic pain, impairs your physical and mental performance, raises your blood pressure, alters hormone levels and metabolism, can lead to brain shrinkage, and prematurely ages you. That's lack of sleep. Now, the do's and don'ts. Number one thing, don't, before you sleep, no stimulating or stressful activities before bedtime. This means no TV watching, no stimulants like caffeine, no dark chocolate that contain high levels of caffeine, no alcohol. It disrupts REM state of sleep. You do not want to take drugs to induce sleep. You're not getting healthy sleep. Avoid spicy foods before bed. Avoid blue light exposure 2 to 3 hours before bedtime. It interrupts melatonin production, and that is an antioxidant. No fluids within 2 hours of bedtime. Avoid grains and sugars because this is a fast form of simple energy. No work 2 to 3 hours before bed, and reduce or eliminate all unnecessary medications. Now, the things that you need to do is stimulate that parasympathetic nervous system, that rest, digest, and repair. The parasympathetic nervous system is located in the neck and the pelvis. So if you have an unstable pelvis or pelvic problems, and you're going to notice that if you look at your feet, if you have a bunion formation, that could indicate a pelvis issue. Then keep a regular sleep schedule and be consistent. Establish a routine. This means meditation, deep breathing, aromatherapy, so you're preparing your mind for sleep. Improve your sleep environment. Prep your environment with no noise, no light. Get regular exercise at least an hour before you go to bed. Room temperature no higher than 70 degrees Fahrenheit. The cooler, the better. Eliminate electromagnetic fields. So if you have a Wi-Fi, set it on a timer. Turn it off when you're going to sleep. And if you have any electronic devices, make sure this is more than a meter away from your head. And eliminate alarm clocks if you can. Once you master sleep, I guarantee you're going to be waking up 5 minutes before your alarm. And then reserve your bed for sleeping. Eat a high-protein snack several hours before bed. Now, this provides tryptophan needed for melatonin and serotonin. Eat a small piece of fresh fruit. This, again, helps tryptophan to cross the blood-brain barrier. A hot bath before bed. Again, this is going to relax and stimulate that rest, digest, and repair, that parasympathetic. Wear an eye mask to block out the light because your body goes through 90-minute cycles called rapid eye movement. And this is when you're in a virtual coma where your energy is going to regenerate your tissue. But those rapid eye movement cycles only last 90 minutes. Your eyes will literally open, then they close. If there's enough light to see your hand in front of your face, bam, that fight or flight system kicks up. And then you're going to have to get up to pee or roll over because you're uncomfortable. So wear an eye mask, or it's got to be so dark you can't see your hand in front of your face. Then listen to relaxing audio or white noise. Ideally, it's set at 528 hertz. Journal. Again, this quiets an overactive mind. And when you're journaling, you're only going to write down what you did that day, what you're going to do the next day, and any emotionally charged event. And then read a paper book 15 minutes before bed. No electronic devices. Remember, electronic devices do two things. They emit a blue light, which interrupts melatonin. That's an antioxidant. But it also puts the brain in a beta wave state, and this can be a stress response as well. Now, prayer and meditation, vital. But even the CDC, okay, says 85% of all diseases is caused by emotions, and doctors do not address this. Up to 90% of doctors' visits in the U.S. may be triggered by stress-related illnesses. And now, so how do you deal with emotional stress? Number one, daily prayer and meditation. Take at least a half hour to an hour a day to get centered, to get in that parasympathetic state. But it also regenerates and reorganizes your thoughts. I love neurolinguistic programming. I've been doing this every day for about 23 years. And it's the I am exercise. It's also called a Moses code: body posture, volume, intonation, and breathing. And you can reprogram that brain. Emotional freedom technique, amazing. And I absolutely love the DeMartini, Dr. John DeMartini, brilliant for traumatic emotional events. Now, two key distinctions about stress. Stress is not equal to the stressor. This means your perception of the stressor is not the stressor itself. That's what the stressor itself that causes the sickness or disorder. And this is why worry is so dangerous. And what I tell patients all the time, what does every religion on the planet say about stress? Well, the more you stress, the better things work out. The more you worry, better. No, that's the exact opposite. Okay, they say, let go, let God. Okay, God never does anything to you. He does everything for you. So when you start to change your perception of what happens, then you change how you deal with that stress. Now, ideally, emotional hygiene transition. Identify your innate values. Now, values are a constant. They don't change. It's like a fingerprint, and each person has different values. Example, unconditional love for God, unconditional love for yourself and your neighbors, the quality and integrity of goodness, the golden rule. So if you have these values, you're going to be living healthier. Step 2, create belief systems, paradigms, and self-talk that are congruent with your innate values. Beliefs are not constant, and they can change, and this is changed on your information. An analysis of your self-talk and your actions on a moment-by-moment basis is essential. And this is not a good idea. It's a must. I get a lot of comments that I don't make judgments on people, because that does limit our connection. And I definitely don't watch TV shows that are high stress, such as, Housewives of this town, or where there's always this conflict. And remember the old analogy: you've got two wolves inside of you, an evil one going after your soul and a good one that goes after your soul. And the old saying is, which one wins? The one you feed. Step 3, prepare and plan for successful stress management. Preparation is the key element for everything, including managing stress. Plan all the areas of your life, like your innate diet, a diet that your body can absorb and utilize. Your innate physical fitness program. This means move every joint every day. Your innate adjustments. This means changing your perception of the environment. Your financial plan. This means look towards the future. What is your goal? What are your actual plans that you can make? So this way, writing it down, you can measure it and it can change. Meditation, prayer, self-development time, family time, recreation time. It's vital that you schedule this. And step 4, dedicate a minimum of 40 minutes a day to yourself. This is absolute must for mental clarity. Alone in a room. Examples of personal time activity: meditating, mind quieting exercises, deep breathing, Bible time, devotions. Amazing. There's so much wisdom in that book. Prayer, visualization. Fantastic. So when you look at the 5 keys to health, the proper nerve supply, regular exercise, nutrition, sufficient rest, and prayer and meditation, you can see if you're following all of these, if you make a plan and work that plan, then your body has the best chance to regenerate. Now, Post your questions, comments below this. We're going to get to as many questions and responses as we can. And we do have to divide the questions up into ones that I can answer on social media and ones I'm going to have to put on our private site. But God bless you all. You're made in the image and likeness of God, and you are in a stressful environment, but you are designed to handle and adapt. You're an adaptive being. God bless you all. I love you. Stay healthy, my friends.